Okay, a very good afternoon and salam sejahtera to everyone. Okay, basically today's webinar, we have one CPD point. So those of you all, please collect these points. Later we will do the QR code scan. You can do that. Those yang tak sempat, we can also MMA will also upload in the system in the 2 weeks time. Okay, basically today's the topic is all about briefing and encouraging more general practitioners to participate in the national vaccination COVID-19 vaccination program. And here I'm Dr. Arasu, the Secretary General of the Malaysian Medical Association, and on my right is Dr. Sivanesan. He's the Chairman of Private Practice Section of the Malaysian Medical Association, and we have Dr. Anas Alam Faizli, CEO of Protect Health, and we have Dr. Gan Sochian, Head of Provider Management of Protect Health. We have Cik Nur Hafizal, Muhammad Amzal, Project Manager for Protect Health. Okay, basically, as we know, I think later they will update, we have close to 2,000 GPs clinics which has registered and will be participating in this program. And with the current, currently it's all about 30 doses a day, 3 times a week. So we may not be able to achieve the 70% target. And I think in many countries, the primary care physicians play a very important role in the immunization. Us being well distributed and also closest to the community, we can surely play an important role here. So today is for those who are yet to join and then to encourage you all to join. Okay, just an overview of the project. Okay, one of the contentious issues that was brought up was in regards to the fees. Okay, just to highlight, okay, Protect Health has no control over the fees. Protect Health is just a company, a registered company, 100% owned by the Ministry of Health, which actually implements this project. The policy on the fees is decided by the government. So anything related to the fees, we have to direct that question to the government. So today we'll be talking more into the project and then the implementation part of it. Okay, without much further ado, I'd like to invite Dr. Anas Alam Faizli, CEO of Protect Health, for the presentation. To you, Dr. Anas.
Slide is dia tak full.
Okay, Assalamualaikum, salam sejahtera semua GP, warga-warga GP. Pertama sekali saya ingin mengucapkan ribuan terima kasih kepada Dr. Arasu dan Dr. Siva dari Malaysian Medical Association kerana telah sudi untuk jointly organize this briefing. I'm just checking, can everybody hear me? Okay, thank you. So thank you very much for attending today's briefing. As Dr. Arasu rightly pointed out, as of today we have over 2,000 GPs that have registered with the program. Of course, today why we have this briefing is to invite the other remaining 6,000 over GPs that have not registered yet to participate in this national COVID-19 immunization program for phase 2 and phase 3 to know more about this program, and hopefully we will have more numbers, more GPs that is registering under the program. Next. Before we begin the briefing, I would like to take a bit of your time to introduce Protect Health Corporation Sdn Bhd. Like mentioned by Dr. Arasu, Protect Health was incorporated in December 2016 as a wholly owned subsidiary of Protect Health Malaysia and established under the Ministry of Health, MOH. As a not-for-profit company, we coordinate, administer and manage initiatives related to financing healthcare services as mandated by MOH. Protect Health were established with 2 mandates: to do voluntary health insurance for all and as a strategic purchaser to reduce healthcare costs and to enhance primary healthcare. The current focus is for Protect Health as a strategic purchaser. As everybody is aware, in 2019, as per our strategic purchaser mandate, we, Protect Health, carry our role as the healthcare scheme administrator for PECA B40. And last year, we were appointed as the ESP operator for Skim Perlindungan Insurans Kesihatan Pekerja Asing, also known as PIKPA. Given our experience and capabilities as a strategic purchaser, in February and recently 8th of March, it was announced that Protect Health is the implementer of GP's participation in the National COVID-19 Immunization Program. Next. As mentioned earlier, Protect Health is a not-for-profit company, wholly owned by MOH, established under MOH. Next. Just to share a bit of background on our chairman. Our chairman of Protect Health is Tan Sri Datuk Sri Dr. Nur Hisham Abdullah, who is also the Director General of MOH. Next. This is a bit of introduction about myself. I am recently appointed the CEO of Protect Health. I'm here only for one hope, that for future generations to inherit a better Malaysia. And I seek all the GPs' cooperation and assistance to ensure that this COVID-19 immunization program is smooth and we achieve the herd immunity targeted by the government. Next. Just to introduce our board of directors, our chairman, as mentioned earlier, is Tan Sri DG. We have one representation from MOH, the KSU, Datuk Shafiq. We have one representation from MOF, Datin Rosni. And we have two independent directors, Encik Johari Abdul Muid, who is formerly EPF Deputy CEO. And we have one other independent director, Encik Nur Hisham, who is currently EPF Chief Strategy Officer. Our key leadership, we have a technical advisor, Datuk Dr. Shahnaz, who is also formerly Deputy DG of MOH. We have a plethora of a mix of secondaries from the Ministry of Health. We also have a representation from the corporate and industry. And we have in Protect Health 5 public health specialists and more than 30 medical doctors on board. Next. This is to share Protect Health's core values. It's called Act Right, accountability, commitment, teamwork, reliability, integrity, technology and innovation, and empathy. As you can see later, that Protect Health emphasis on technology and innovation, where we want to do everything digital, and on empathy, where our focus is on the improving healthcare delivery system in Malaysia. Next. Just to share with all the GPs out there what we have done since 2019. PECA B40, it is an initiative by the government aimed at addressing the health needs of the lower income, focusing especially on the non-communicable diseases. PECA B40 is offered to Malaysians who fall within the lower 40% of household income range, known as the B40 group. As some of the GPs have already participated, the first benefit for PECA B40 is the health screening, which is quite comprehensive, where we have medical history taking, we have mental health screening, and also CBE for female recipients and prostate for male recipients who are at risk. And under this health screening, we also do blood and urine tests. Next. Once the beneficiaries done the first health screening, they are also entitled to other benefits that the government is giving to assist them in needs. Benefit 2, a maximum of 20,000 is given to the recipient in the form of purchased medical equipment. So if any of the beneficiaries under B40 need any of this medical equipment, Protect Health will purchase for them and the government will provide this medical equipment to the B40 population. We also have benefit 3, cancer treatment incentive. When you complete the treatment, there is some incentive given to the beneficiary. And as we know, there are some in the B40 community who is not going to the hospital for treatment due to transportation issues. Here, PKB40, we provide transport incentive. Next. So under PKB40, at the moment, we have 182 pathology labs all over the country. We have 894 government clinics in the program. We have 131 government hospitals in the program, and also 2,000 GPs already in the PKB40 program. And under the ESP SPICPA, we have 25 insurance companies and takaful operators with 2 third-party claim administrators on board. Next. Just to share a bit with all the GPs on PKB40 achievements, as of last month, we've screened close to 500,000 beneficiaries. And this is very important, especially on addressing the non-communicable diseases. Why? As of end of last year, we've classified and diagnosed over 150,000 beneficiaries, which is classified as newly diagnosed NCD cases. The cost saving to the government by early treatment and prevention of complication is massive and can go up to billions of dollars of ringgit. So this is a big and important achievement under PKB40. Next. So just to give a bit idea of SPICPA ESP, we are the operator where we manage the data medium between the takaful insurance operator and government hospitals. Next. As for today's briefing, most importantly, I think all the GPs want to know about the implementation of the COVID-19 immunization program. So Protect Health has been appointed by MOH to implement GP participation in the National COVID-19 immunization program. And at the moment, we have 3 models for all GPs to participate in. The first model is the straightforward one, doing vaccination at your clinic. And of course, the government has agreed. As everybody is aware, the current method of vaccination is allotment, where you are told where to go for your vaccination. Most probably at your nearest GP or your nearest KK. However, under this program, GP will be able to provide vaccinee list. And we do this because we understand the GP close relationship with their patient, where some family have certain family doctors, etc., etc. And here is where the GPs will provide the best added value to this program. Secondly, the community outreach, where the GPs will be able to partner with other GPs, or Protect Health will assist to do community outreach, where GPs can go to old folks' home and do vaccination. GPs can go to factory and do big number of vaccination, and also can go to offices. I understand some GP are already panel of some big corporation, and the community outreach model, I'm sure, will be fully utilized by the GPs. We will brief all the GPs as we know more on the community outreach model. And finally, GPs will also be able to participate in mass vaccination program organized by the government. Under this model, the government will organize everything. MOH and MOSTI will organize, and the GPs can come and do the vaccination on site. Next. So before we begin the briefing, quickly I will explain about Protect Health capabilities and why we are here. Protect Health is capable to do strategic purchasing. We have experience and have developed PKB40 benefit packages for the, and also we have developed the payment mechanism and contracting of providers. And last year, through price negotiation, we have successfully saved government over 10 million ringgit. And this is specifically for the purchase of the drug eluting stent. And Protect Health, we have our own digital management system, a proprietary developed in-house where we have our BMS, the Benefit Management System for PKB40. And recently we have the Vaccine Control System, VCS, for this program. And we also have in-house medical claims management capability where since inception, we have processed more than 500,000 medical claims. I think all the GPs out there is very well understand that medical claims is the most complex claims in the industry or any other industry. Next. We also have in-house customer relationship management where we have dedicated team to manage all inquiries through telephone, emails, and also social media. We also have a medical audit team which can perform GP audits, both periodic and random, also investigated data anomalies. Of course, we will not do what CCAPs do. This is just on top of an additional requirement to ensure the quality improvement of patient outcomes and protection for effective healthcare system. And finally, PKB40, through Protect Health, we have done over 49 outreach programs nationwide. And this is such successful model that it has garnered international recognition. And last year, we won Best Presentation during the second International Conference on Public Health and Wellbeing. So it is pretty much my introduction on Protect Health. We are here to strengthen the partnership between the public and the private. And we hope to be that bridge between the Ministry of Health and with all the GPs. So without further ado, I'll pass to Dr. Gan and Sheikh Nur Hafiza to explain more about this program. Thank you.
Thank you, Dr. Anas. Good afternoon, everyone. I'm Dr. Gan. I'm coming from Planning Division, KKM, and I'm currently seconded at Protect Health Syndrome Berhad. I'll bring you through the program of PIC and how GP can participate. I'll cover what are the requirements for you to be participate and how can you register and train for this program. And I will explain to you further on one of the first model that is going to be launched first, which is the clinic model. And also I'll let you know more about the fee and payment. So as Dr. Anas mentioned just now, GP can participate in this program, and the scope of services that is expected to be involved include order and collect and store vaccine, manage the cold chain, and include you need to do pre-vaccination assessment before vaccination. You need to explain to the patient and get the vaccination consent. You need to administer the vaccine and perform post-vaccination observation for 15 or 30 minutes according to patient condition, and manage AEFI in the rare event that when it happens. Of course, you will need to also manage and report vaccine stock, use, wastage, and disposal. So all this scope of services has to be done by a GP when you are registered, when you are providing the vaccination at clinic, and also in the future at the community outreach program. Comparison, if you are participating in a mass vaccination program organized by the government, as Dr. Anas explained, you might be required to do one of the tasks listed above as required by MOH. So currently, we are going to first launch with vaccination at clinic in the May, but if you are interested in any of the model above, please register with us at vaccinecovid@protecthealth.com.my. This is because that with your registration, we will get you ready, and then we will be able to keep in touch with you if there is any more model that is going to be rolled out. So what is the requirement for a GP to be registered? The first requirement is for the GP to own a clinic which is registered under Private Healthcare Facilities and Services Act 1998, and then you need to be able to adhere to the manuals co-developed by Protect Health and MOH when you're doing the vaccination. You need to undergo COVID vaccine specific training. You need to have IT devices such as laptop and Android phone and internet access to complete and participate in this program. because you will need to use several Protect Health on and KKM on deep systems. Lastly, of course, when you carry out the vaccination task, you will need to use the appropriate PPE, which is usually surgical mask, eye protection, plastic apron, and gloves, depending on the task that you are going to carry out. As we mentioned just now, there are 3 models. So if you are if you are participating in mass vaccination, the requirement will be you as a doctor that attend to the program. However, if you are going to carry out vaccination and clinic and community outreach, you will need to have appropriate trained medical and non-medical staff to help you. You will need to be able to manage cold chain yourself, and hence you need all the equipment such as cold box, temperature digital data logger, pharmaceutical fridge. You will need to be able to order and collect vaccine from the nearest MOH facilities, because now the vaccines are all purchased by the government. And you will need to make sure that you are able to set up the setting either in your clinic or during the outreach, that to allow the patients to have adequate space for physical distancing, no matter when they are waiting, when they are being given the administration of the vaccination, or when they are being observed after the vaccination. Last but not least, you will need to have the basic emergency equipment ready in the event of a rare severe AEFI, that you will need to use it. So as of 1st April, we have 2,080 clinics that already registered with us. We would like to thank you all very much for your supports, and we hope that your continuous support will come, and then we hope that we will reach far more than these numbers. As you can see now, we have GPs from all the states in Malaysia that is joining us. For those who haven't registered with us, the registration only required 4 documents, which is your Borang B and F, the PIC MMC full registration certificate, and the PIC latest APC, and of course the proof of bank account for us to pay you through the account later on. Just to very quickly to point out a few reasons that cost around 15 to 20% of the registration incomplete for now is usually the incomplete documentation or incorrect information field. It is usually because of outdated APC or LOA signed without official clinic stamp. And sometimes when the GPs fill up the registration, they provide the different name from the Borang B or F, or the bank account that is submitted, the name of the entity of the individual is different from the Borang B. If during the registration process any of this happen, we will be reaching out to you. Don't worry. As well, if you have any query or doubts about the registration process, you can always email and contact us at providervaccine@protecthealth.com.my. I will pass to Cik Fiza to explain the cold chain requirement.
Thank you, Dr. Gan. Good afternoon all. I will briefly explain on the COVID-19 vaccine cold chain requirement. The cold chain management at clinic is regulated under Act 586, and it also applies to COVID-19 vaccine. Hence, CCAPs will assist to ensure cold chain readiness of GP prior to starting the program, as well as routine monitoring throughout. Another useful reference is the good distribution practice that covers the distribution, storage, and handling of vaccine. COVID-19 vaccine is considered as time and temperature sensitive product. And as you might be aware, MPRA has given conditional registration for 1 year to Pfizer BioNTech vaccine based on the phase 3 clinical trial data. Further monitoring of the efficacy and safety will be needed in order to ensure that the benefit outweighs the risk of vaccine. Hence, due to the conditional registration, a good cold chain management should be applied. Next. For your information, GP may receive the third Pfizer vaccine. This is based on the current MOH policy, and any changes to the current policy, we will update everyone. Therefore, under the National COVID-19 Immunisation Program, GP is required to store COVID-19 vaccine using pharmaceutical refrigerator, that is the preferable storage, or refrigerator dedicated to storage of pharmaceuticals. The refrigerator should be equipped with electronic temperature data logger with twice daily temperature monitoring maintained between 2 to 8 degrees. So the top Pfizer vaccine is within 2 to 8 degrees for 120 hours, which is around 5 days. And the third Pfizer vaccine should not be stored in the freezer. Here are examples of the pharmaceutical refrigerator. And just a reminder that combined refrigerator or freezer unit is not permitted under any circumstances. This is due to the design of the fridge that poses a significant risk of freezing vaccines, even when used for temporary storage. Next. So as mentioned previously, GP are also required to collect vaccine at the nearest MOH facility assigned. So GP may select representative on behalf to collect vaccine, but must bring a letter of authorization from the clinic, and the person must be trained to handle vaccine cold chain. And the person must bring their identity card, the IC. So for vaccine logistic, GP is required to use preferably a WHO pre-qualified cold box or medical grade cold box during transportation of COVID-19 vaccine. So these are several examples of cold box. And electronic temperature data logger is required for monitoring the temperature during the transportation, as they monitor the vial temperature throughout the journey. So this temperature logger enables the user to log the temperature readings with time and date stamp. So user can actually export the data and to a PC and can be printed, graphed, and exported. So these are examples of electronic temperature data logger, and this might be useful when there is any temperature excursion, whereby you may need to contact MPRA for further advice. So they will need to actually see the readings throughout the journey, throughout the day. And so because if there is excursion, they may need to know whether was it 10 minutes ago or was it overnight, so they can properly advise. So I pass back to Dr. Gan to continue the session.
Thank you, Fiza. So that was the requirement for cold chain that we choose to highlight in this briefing. Of course, there are more details, and which not only include the cold chain management, we also include how to handle the vaccine, how to dilute, how to administer. All this will be provided in a separate session of training. So we are going to have a repeated continuous training session that is going to happen. The first round will happen next week. For next week, we have prepared 3 separate sessions on Monday, Tuesday, and Wednesday from 2 p.m. to 5:30. Interested GP, please, after registration, you should also sign up for this training, which would teach you how to handle the vaccine. And then we'll have MPRA, we have all the other KKM representative to pass on the latest information to you. So at the below is the link of the registration for training. We will later post it at the chat box. Now, what I would like to dive into is the vaccination at clinic model. Okay, this will be the first model among the 3 that is going to be first rolled out for the GP. So vaccination at clinic is going to be called, for the GP that involved, they are going to be called Pusat Pemberian Vaksin GP or PPV GP. It will be rolled out in May, and then for the time being, the vaccine that is being used is Pfizer-BioNTech vaccine. As you know, the Pfizer vaccine, after it's being taught, the shelf life is 5 days. Hence, we have the model as below. Under this model, for a start, we will expect GP to collect vaccine from designated site, a KKM facility, either it's a PKD, KK, or an extra, which is near to you, on Tuesday morning. And on the same day, Tuesday, and the subsequent Wednesday and Thursday morning, you will then be delivered the doses. For the time being, the doses involved is fixed at 90 doses, which is 15 vial, which are expected to be delivered over the 3-day, 5 vial, 5 vial, and 5 vial, 30 doses, 30 doses, and 30 doses. We are currently working with the MOH to provide more scheduling options. If we can work it out the detail, we will be announced to you soon. And in order for you to be able to start and participating in this program in May, you will still need to go through a onboarding process, which I'll explain to you later. That onboarding process will start in April. And also under this PPV-GP model, as explained by Dr. Anas just now, we have discussed and get agreement from the KKM to provide the avenue for GP to submit their existing patient list, which I will again explain further. So to become a PPV-GP, you need to register, as I show you just now. You need to go through the training that we will have it next week, and you need to have the cold chain equipment ready. Once you have get all those things ready, you will go through an onboarding process, and then every week you will be able to implement. You will be able to carry out the vaccination program. You can proceed to the onboarding once you have completed your training and cold chain requirement through our website, which is a vaccine. We have a system called Vaccine Control System. Once you confirm your readiness with us, we will communicate with the various KKM departments and stakeholders. The end result is that you as a GP, you would be informed which is your designated collection site. It is usually the nearby PKD, KK, and extra. Okay, and also you will gain access to the necessary IT system, which is MyBus. You need to have a laptop, and which is MyBus, which is the Malaysia Vaccine Administration System, which is the provider model for MySejahtera system, where you will receive the patient list and so forth. And also VMS, Vaccine Management System, which is KKM using it to track the whereabouts of each and every vial of vaccine. You will need an Android phone to operate it. Once you've gone through the onboarding process, you get the system ready. Every 2 weeks before the vaccination day, you should receive the patient list pushed by the MyBus to you. So means that this is what we call, Dr. Anas call it, the allotment system, where the KKM will provide you the vaccine list. Okay, so you don't need to worry about whether where I can find those 90 patients every week. Okay, so after you receive the list, 1 week before the vaccination date, you will need to order the vaccine, usually through email or fax to the designated collection site. You will be given the contact of the liaison officer. After that, again, on Tuesday, you collect the vaccine, and on Tuesday, Wednesday, and Thursday, you administer the vaccines. Because, just a note, because we are using Pfizer now, when you collect the vaccine on Tuesday, that is actually the second day that the vaccine will be taught and outside the ULTF. Hence, all the vaccine that you collect must be finished latest by Friday. Okay, and please take note also, because this vaccine is purchased by the government and is going to be given to the GPs for free. And at the KKM side as well, we apply the same policy of zero wastage, which means that if among the 90 among the 90 patients that are being told to go to you, if some of them happen to be absent or happen to be not able to receive the vaccine that day because of perhaps acute febrile disease and etc., you will need to utilize a backup list that you should be preparing to minimize the wastage. So this, the further detail will be taught in the training program. Lastly, is the vaccination for your existing clients. As Dr. Anas mentioned just now, we would like to encourage the public to receive regular preventive care at a primary care facility, their family doctor, And then this is to leverage on the established patient-doctor relationship to reduce the vaccine hesitancy and improve client satisfaction for our program. And what the client need to do is they need to register themselves for vaccination, and then they give their name to you, and then we will prepare a platform for you, for the GP to inform us who are your regular patients that wish to be vaccinated at your PPV. The end result would be when the turns of the patient come among the national scale, when his turn comes to be vaccinated, my VAS system will try to put your patient back into your clinic. So there will be no earlier queue, but they will be given chance to be served by you. So in summary, what we have now is a PPV GP model that is going to start in May. It will start with Pfizer vaccine. Please remember that you need to complete the onboarding process by April. And afraid not, if you are not able to be on board in April, the onboarding process will be continuous. We will be allow the GP to continue to join when you are ready. And the vaccination model is, for the time being, is from Tuesday to Thursday, 90 doses every week. And you will be able to submit your vaccine list to us. Lastly, I think many of us have already know, but just let me reiterate again. As a token of appreciation from the government for the contribution from the GP, the government will be paying 14 ringgit per dose administered at each of the clinic or community outreach. If you are being called to join mass vaccination program, the government prepared to pay 45 ringgit per hour rate. Again, the detail for community outreach and mass vaccination will be announced later in the future. Lastly, the payment will be gone through the bank account that you provided to us, and the payment frequency will be about once a month. This is our contact number, our email, and you can contact us at our customer relationship help desk that we explained earlier on, and you can always get more information from our website, protecthealth.com.my. Thank you.
Thank you, Dr. Anas, Dr. Gan, and also Sheikh Dr. Hafiza. So now we'll hand over to Dr. Siva, who will be moderating the Q&A.
Thank you, Dr. Arusu. Hello to everybody there in PHCOP. Before we go to the Q&A section, we'll put up our QR code now. As Dr. Arusu mentioned, we will get 1 CPD points for your attendance today. Your QR code will be there for approximately 1 minute. Okay, that's a QR code for you to get your CPD points. It will be there for a few minutes, but can I start the ball rolling, Dr. Anas, with some questions? Yeah. Can you all hear me in PHCOP?
Yes, yes.
Okay, thank you. There's one question here. This is from a Solo GP, I guess. It says that they have a small setup. So taking in 90 shots a week will be a bit hard for them. Is it possible for them to take smaller lots?
Okay, Dr. Siva, I can answer that question. As we mentioned just now, at the moment, Dr. Siva, we are working closely with KKM and also MySejahtera developer to have flexibility of the doses where it can be lower than 30 doses a day. We hope we can do this, and if the option materialize, meaning let's say a GP chose an option of 30 doses a week, so they collect on Tuesday, so they have 4 days to finish the 30 doses. However, this difficulty in finishing within 5 days only apply to Pfizer vaccine. Once we have more vaccine portfolio, once we have more option, and once the government is ready to roll out the other vaccines, we will not have this limitation because the vaccine can be stored much more longer.
Okay, thank you, Dr. Nas. The second question, can an ambulatory care center be a PPV?
Can I what?
Ambulatory care.
I tell
Uh-huh.
for the time being, it's only open for GPs, clinics, so not for ambulatory care center.
Thank you. Can a locum doctor participate in providing the vaccine?
Yes, Dr. Shiva. A locum doctor can participate in providing the vaccine. However, for administration purposes, it is best for the particular locum doctor register or write on an existing GP that is already registered in the program.
I think this is a frequently asked question. This is from Dr. Fu, I believe. In the event of a patient after vaccination developed a reaction that requires resuscitation and emergency care, who would be bearing the expenses occurred, such as administration of oxygen, setting up IV drips, and engaging ambulance services?
Currently, all the AEF5 that happen within the 15 to 30 minutes immediately after the administration, the GP are not allowed to charge patient or the Protect Health. So it has to be absorbed by the GP.
That's a bit high cost to be absorbed, I think. Yeah.
Maybe explain more, Dr. Gan, on the EA5.
So the management part, of course, I think if there is a severe AEFI, you would refer to the nearby KKM facilities, hospital. And I think another different question that usually asked is what is the liability? So what we can say now is, I think you might have aware, at the end of March, government have already set up a special fund to compensate for any patients, any vaccinees that have severe adverse effect after AEF5. So if you have some severe AEF5 that warrant a prolonged hospitalization, government has prepared a 50,000 up to 50,000 ringgit compensation for them. And if there are severe permanent instability or death occurred, the compensation can be up to 500,000 ringgit Malaysia.
Dr. Siva, Dr. Arasu, we do not have the numbers yet, but accurately, but roughly for now, the cases of AEFI is very minimum. It might be considered very insignificant. So another way to see it is perhaps like, I know the token of appreciation set is fixed for fee services, but in a way on the AEFI, you can look at it from capitation perspective. After a certain amount of volume that you do, most probably there might be 1 or 2 incident of AEFI after vaccinating 1,000 patients, for example.
Okay. Thank you, Dr. Anas and Dr. Gan. Dr. Gan, I have a question for you.
Yes.
Will there be a dedicated line in the event of any emergencies or anything the GP wants to consult with the nearest clinic kesihatan?
Okay. For emergency patient condition, I think we would still rely on the current emergency response network. Either it's linking back to PKD, KK, or hospital. For the operation purpose, if anything related to the vaccine management, there will be SOP in place that you will be being taught in training, you will be provided in manual. In short, normally what you may need to contact is MPRA, and then of course you would also have the contact of the licensed person of the designated collection site, which should be working with you closely. And of course, on top of it, Protect Health do have a hotline that operate at the most of the time. You can also call us that to coordinate all the things.
Go to the slide tadi tu yang ada nombor.
Dr. Gan, so in summary, I can tell to all our colleagues here that in the event of any, especially if, I think most of them might be clinical issues, they can always communicate with the liaison officer at the vaccine collection center, or they can also consult with Protect Health on their hotline. And this hotline will be manned by doctors or
so our hotline is manned by our customer relation service. It's not meant for medical consultation.
Okay. So that means the closest is liaison officer at PCC lah.
No, we don't get you, Dr. Arasu.
Okay, basically, see some of the what we have gathered from the various social media among the GPs is that because the fear is there because this is the first time you're doing it. So I think everybody trying to be overprotective. So basically, what they're asking is that in the event of anything for them to consult related to clinical side, so that means they would like to have someone that they can communicate with. So the closest that I can gather is that it could be a liaison officer, provided it's a medical person at the vaccine collection center. But in the event if they do not have, probably this is something that Protect Health can inform the Ministry of Health that probably in the first 1 month, 2 months, something like that might be needed because we do not want panic situation. Somebody that we can always consult, even though the AEFI is very, very minimal, but just in case for that.
Thank you, Dr. Arasu, for your feedback. It is something that can be considered. Thank you very much, Dr. Arasu. We will work with KKM and bring up this issue.
Okay. Just one question. Thank you, Dr. Anas and Dr. Gan. Okay, this one question is to Cik Nurafiza. I think this question on the refrigerator is always coming up. Okay, basically, many are very confused because of when we put that preferred pharmaceutical refrigerator, or we can use the normal refrigerator. So probably you can highlight a little bit more on the normal refrigerator that can be used by the GPs for this storing of the vaccines.
Dr. Arasu, if I may answer, and then Cik Fiza can add. What we mentioned in the requirement is pharmaceutical fridge. Dalam kurungan preferable. And we have agreed to allow dedicated refrigerator for pharmaceuticals to be used. Now, the challenge is if in one compartment it is sharing with a freezer, you cannot store the vaccine inside the same compartment. But if you have multiple doors and you have doors that is dedicated as a fridge without the freezer portion, then it is allowed. The most important part is the temperature logger. Now the temperature logger we've looked in the market, and the price is around 200 ringgit or less. Cik Fiza, anything to add?
Yeah. So, like I mentioned earlier, pharmaceutical fridge is the preferred option. I think this is because the design of a purpose-built pharmaceutical fridge will ensure the temperature is stable. The fridge has its design, for example, a fan force. Fan force will make sure that the circulation is stable and there will not be any temperature excursion. So of course that is the preferred option, but I think you could also use existing fridge, but the extra requirement is the electronic temperature data logger. So the data, so that is something that MOH would put that condition that you need to have it in your existing fridge. And any excursion, they will probably need to look at the lock, the temperature lock, and seek how to advise on what to do with the valves, because the valves may need you need to record it as wastages, because it might not be able, you cannot use it because the excursion might be because if it's for excursion, you only have 2 hours to use the valve actually. So that is within the MPRA advice. So that's why, of course, we would advise you to, you know, use the proper fridge. But I guess for now, just make sure they will look at the temperature lock to advise on this. Yes.
Yeah.
If I may add, I think first is pharmaceutical fridge is designed to have a more stable temperature, so it's easier for you to manage. But we are not saying that you must use pharmaceutical fridge. So you can use whatever fridge you have, as long as there is no freezer compartment inside. You get yourself a data logger, and you know you can actually pre-test it. You can put the data logger inside, close the fridge, and then what you can open it up two times, 4 times during the day, and then after that, you take out your data logger, you plug into your computer, and then you will see the reading, and then you will see whether your fridge can handle the opening and close that 2 or 3, 4 times. So if your fridge can handle it, then it shouldn't be a problem.
Dr. Rasu, I would also like to address one question that I saw in the list. A GP is asking if they have not been vaccinated, can they do vaccination? We can check back with KKM, but as far as I know, there is no procedure that is saying that vaccinators must be vaccinated before giving vaccination. However, we can try to assist to push the GP that has not yet vaccinated to be vaccinated as soon as possible. That part we can assist.
Thank you, Dr. Anas. Hope we can help lots of doctors there. Another question asked is that in case there is a wastage, say while it's for 5 people, 6 people, somehow the final one is not there, is the GP answerable for that?
So basically, we will have the SOP which you need to actually prepare a backup list. So you will need to call up your backup list. It can be your client living nearby, as long as it fit into the phase 2. It can be the carer that actually bring the client to come to you, and etc. So we really, the KKM direction is work towards a zero wastage. In any event of no use, cannot be used, broken, lost, all those, you will be required to make incident report. And for the time being, there's no penalty.
So just to add that, Dr. Rasu, during the training, we will show how it is done. Example, for Pfizer, 1 vial is 6 doses. So what we will do is, typically what is being done at the moment is, we will wait for all 6 patients already arrived at the GP, and only then you will open the vial and do the vaccination. So it is being done 6 persons at a go, 1 by 1.
Together with the Pfizer vaccine, the government is going to provide also the low-dead volume syringe, so which will help you to make sure that you get the 6 doses. And those syringe has come together with the needle. So which means that at the Pfizer, for the current being, you will not need to purchase the syringe and needle that you need to inject.
Dr. Khan, I'm interested in the backup list.
Yes.
backup list a fixed list or we can change from time to time?
You can update it.
You can update it.
Yeah, so that list is just with you. So you do not need to pre-enter into the system.
Okay. That's can we accept a foreigner in the backup list?
In phase 3, you might be able to do so, but we are still waiting for the detail as well, because I think the question is how foreigner fit into the MyVas system. That one we also still lack of detail. We are still waiting for KKM instruction.
There are certain things operationally is still work in progress, Dr. Arasu, and we are working closely to finalize all the details. But we will have more information during the training, and as we roll out the program, we will improve on the operations.
Okay, this question I think we asked the other day. Lots of people are interested in the temperature logger. Can we know where can we get it? Remember we asked you the supplier or list of suppliers who can provide this, and hopefully you can get us with a subsidized price for the GPs who don't have a logger, temperature logger. Is it possible to enclose the list where you can get it?
Fiza?
Yes, we will share some of the suppliers list. We've been doing that. We've been getting quotations, and we will try to assist the GPs. Maybe after this, we will send a letter out to share some of the supplier that we managed to get the quotations, and see how we can move further to assist some of the doctors who may require these cold chain equipment.
Yes, but just to highlight, we are not promoting any suppliers, Dr. Arasu?
Yes, yes. We take note of that. Okay, there's a very good question here. If I'm not keen in vaccinating using the Pfizer vaccine, is there an option or choice for later vaccination?
In the future, the government may provide other vaccine for GP use, but for the time being, the policy is the PVV do not get to choose what vaccine. This is the current policy.
Yeah, this is due to the enormous logistical constraint and planning required if we customize a certain location. Different GP will have different vaccine. So as a result of that, currently the policy is we are unable to choose which vaccine.
Thank you, everyone. I think, yeah. Okay, we can ask one or two questions because I think it's almost 4 o'clock, 4:02. And okay, let me ask a few questions. Can we deregister as PPV after joining this? If let's say a GP after for whatever reason they feel they want to back out from this, can they do so?
So Dr. Siva, there is an option for an exit plan where the GP would need to notify Protect Health 30 days in advance or 1 month in advance.
Okay, thank you. I think there's also another question which was answered earlier. When is the date of submission of the name list to get the vaccine?
Pardon?
After the training, when is the date of submission of the name list to get the vaccine? That means when do they provide the name list?
So when the GP can provide the name list, is it?
Yes.
To MyVas.
To my
2 weeks can.
MyVas would provide the list to GP 2 weeks prior. So actually, it's a weekly cycle. So, but you expect to get it 2 weeks prior to that. Okay. The other hand, if you are talking about GP submitting the existing list, that one we will make it available and soon.
One question is that I believe that with all this preparation, the person who's supposed to receive, get the vaccine, or person who's supposed to be vaccinated will get the notification from My Sejahtera, isn't it?
We don't get you, Dr. Shiva.
No.
Here.
Okay, say somebody is going to be vaccinated in my clinic. So that person will be getting notification from My Sejahtera, right?
Yes, correct.
Do the clinic have to call to reassure that the person comes, no?
We encourage you to do so to minimize no-show, but it's not compulsory.
Okay, there is last few questions. There's Dr. Choi has mentioned that there was a mention of requiring Android phone. Can iPhone be used instead? I'm not sure what he meant by requiring Android phone.
Because the vaccine management system, which you need to use to scan when you receive the vial, the vaccine vial, unfortunately is only available on Android operating system. So if there is no iOS, so you cannot use Apple phone for it. You might need to borrow your assistant phone or whatever. You might need to purchase an extra one to do so.
See. Okay.
Anas,
Yes.
maybe a final question. As you know that we've been hearing, we are hearing the GPs very loud and clear that they might need some assistance in carrying out this task. This including the maybe subsidizing buying some of the equipment that we might use in this. So can the KKM or Protect Health buy in bulk purchases and then supply to the GPs?
Dr. Shiva, good question. At the moment, we have had discussions, but the policy is decided that Protect Health will assist in terms of providing the list of suppliers, and we will try to speak with the suppliers if they will support this PICK program and give good value for money to all the GPs. But no policy has been set for Protect Health to purchase on behalf. And in order to subsidize Dr. Siva, we are actually a wholly owned company by MOH. We are not for profit. So in order for us to subsidize, we need to have a source of subsidizing, which we don't have, Dr. Siva.
Okay, thanks for the answer, Dr. Anas. I think that's a question.
There's one question. Dr. Catherine has asked a question. I'm currently not a practicing clinician since I resigned from the previous private hospital in 2018. As such, I do not have a valid APC for year 2021. Is there any way I can to provide? I think this one, it is understood that we need to have a valid APC.
Yes.
So I think better check with MMC and how can you get the APC done. Okay, I think before we close the session, I would like to just share 2 slides and why it is very important for the GPs to participate. Okay, I think a few days ago, YBKG has mentioned that the GP's contribution is going to be very small in terms of reaching the numbers on the herd immunity. And we have 8,000 plus 1,000, we have 8,000 GP clinics. Even if 5,000 of us are participating and 30 per day, we're talking about at least 150,000 a day. At least we can cover 600,000 vaccination a week. So that is why it is very important to all of us to play an important role. If you look at the government's target under the phase 2, they're looking at 6 million. And then the other population is 13.5 million. So they're looking at 20 million to be vaccinated in a very short period of time. So if all of us can help, then we can achieve the herd immunity faster. So definitely, this is first time in our lifetime anyway. So we hope that we can also, we understand the challenges in terms of the fees. Okay, we understand about that. But let's find a way. How can we assist so that we all can go back to normalcy? So I think with that, we would like to thank all our colleagues who participated today, and then Dr. Anas, Dr. Gan, and Chief Officer from Protect Health for these insights and also engagement. And then we believe with the training and contrasting, we can only get better and better. We can understand better. And with that, thank you very much and have a nice weekend. And we'll display the QR code for your CPD points. And just to remind everybody, especially the GPs out there, by the 30th of June, we must get 20 points. At the moment, the Malaysian Medical Council is not going to extend it at this point of time. And apparently, only 30% of them have achieved 20 points. So 70% are yet to achieve 20 points. Please take advantage of all these free webinars. Even though it's just 1 hour, 1 point, you attend 20 in the next couple of weeks, you can already complete. So with that, thank you very much. We'll keep the QR code for